Ladies and gentlemen, a very good morning to all of you. Before we proceed with the program, I request all of you to switch into the speaker view mode present in the Zoom settings for a better visual experience. Thank you. So, Giridhar Rehabilitation and Care Endowment has great pleasure in welcoming all of you to the third edition of Pragnya 2022, a knowledge sharing session. Theme for the day is Ayurvedic Management of Breast Cancer, its scope and limitations. We are blessed today to have four eminent speakers here with us. Dr. Ram Madhavan, Radiation Oncologist, Cancer Institute, Adayar, Chennai. Dr. Bharati Kumaramangalam, Professor and HOD of Prasuti Tantra and Stree Roga at National Institute of Adayar, Jaipur. Dr. C. Arul Vasu, Honorary Director and Coordinator of Envis Center, Associate Professor in Zoology Department of University of Madras, Gindi, Chennai, and Dr. Sameer Narayan Gori, Honorary Ayurveda Physician in the Integrated Cancer Treatment and Research Center, Pune. Welcome you all. We would like to commence this event with a Sanskrit song written by Mahaperiyava commemorating world peace. I now invite Mrs. Bhanudipti V, Research Associate, to render the invocation and start the event on a harmonious note.
Maitri bhajata kila hrijatri. Maitri bhajata akila hrijatri. Maitri bhajata akila hrijatri. Atmavadeva paranapi pashyata. Atmavadeva paranapi pashyata. Yuddham tyajata spardham tyajata. Yuddham tyajata spardham tyajata. Tyajata parvesha kramakramanam. Maitri bhajata akila hrijatri. Janani prithvi kamaduhaste. Janani prithvi kamaduhaste. Janako devaha sakala dayaluhu. Janako devaha sakala dayaluhu. Damyata data dayadvo janata. Damyata data dayadvo janata. Shreyo bhuyat sakala janana. Shreyo bhuyat sakala janana. Shreyo bhuyat sakala janana. Shreyo bhuyat sakala janana.
Thank you, Bhanudipti, for that melodious rendition. I would like to invite our Ayurveda physician and Senior Research Associate, Dr. A.G. Vaijayati, to welcome the gathering. Over to you, Doctor.
Thanks, Akshaya. Shri Gurubhyo Namaha. A very good morning to everyone. On behalf of Shri Rajashamala Ayush Vaideshala and Giridhar Rehabilitation and Care, a public charitable endowment trust, I welcome you all to Pragnya 2022, commemorating the 30th birth anniversary of our founder, late Shri V.S. Giridhar, who envisioned a disease-free world. We are lucky to have a rich and varied panel bringing together valuable experience and insights from a broad cross-section of professions. We have with us today Our eminent scholars, Dr. Ram Madhavan, Dr. Bharti Kumaramangalam, Dr. Samir Narayan Ghore, and Dr. C. Arulvasu. The crux of this webinar will be Ayurvedic management of breast cancer, its scope and limitations. We hope that this webinar helps clinicians, students of Ayurveda, and other health professions offering the service in the area of breast cancer management broaden their understanding of the disease and adopt best clinical practices to alleviate this dreaded condition. Before proceeding with our agenda, I would like to enlighten you all regarding our journey thus far. Ayush certified GMP manufacturing facility situated in Golden Jubilee Biotech Park for Women, Siriseri, manufactures a range of Ayurvedic products that include unique Shastric formulas, herbal supplements, and natural skincare products. Recent research initiatives include designing and formulating an effective cardiac dietary supplement, an oral dispersible tablet for xerostomia, a herbal supplement for vertigo and menstrual disorders, and a herbal decoction for managing chronic disease. Our products in the pipeline include number 1, an herbal solution to improve the quality of ovarian reserve in women. Number 2, a sustained release transdermal patch for infants and children that can be beneficial in colic, and an emulsion pain reliever for arthritis. Without further delay, I once again welcome you all. Over to you, Akshaya.
So I would like to invite Mrs. Lalita Venkatakrishnan, our co-founder, to commence the webinar by sharing her thoughts. Over to you, ma'am.
Namaste. It gives me immense pleasure in welcoming you all for this virtual knowledge sharing session, Pragnya. From small beginnings come great things, and every small beginning starts with a dream. The dream was from a young boy, V.S. Giridhar, who happened to my son, who shed his mortal remains at the tender age of 23 in the year 2015, and his vision was to create disease-free world through integrated medicines. To translate his dreams into action, we founded Giridhar Rehabilitation and Care Endowment, wherein we carry out research on drug discovery of alternative medicines. We have a dedicated team of domain experts in biotechnology, molecular biology, herbal science, Ayurveda, and Siddha. We also seek the advice of experts in modern medicine to realize the dreams of Giri. We have also instituted Sri Rajashyamala Ayush Vaideshala in 2016, where we provide medical consultation in Ayurveda, Siddha, Varma, and homeopathy. Our Ayush and GMP certified manufacturing facility, situated in Golden Jubilee Biotech Park, Siriseri, manufactures a range of products that include unique Shastric formulas, herbal supplements, and a range of natural skin care. Going forward, we are on our journey to create 2 landmarks. The first one is to offer painless and non-invasive cure to patients ailing from many diseases through alternative medicines. The second one is to create new customized drugs targeted to offer customized cure for patients. Both activities are currently going on in full swing. We believe in sharing of knowledge for the benefit of community at large. Towards this, we organize annual Pragnya series of contemporary topics of relevance. In this third edition, we have invited subject experts to share their rich expertise and experience on Ayurveda management of breast cancer, its scope and limitations. We thank Dr. Ram Madhavan, Dr. Bharati Kumaramangalam, Dr. Arulvasu, and Dr. Samir Narayan Ghore for being here this morning to enrich all of us. We seek your good wishes and support on our journey. Thank you once again for your presence here today with us. Thank you.
Yeah, I think so. You're still on a mute.
Okay, I would like to invite our Ayurveda physician and senior research fellow, Dr. M. Hari Krishnan, to now introduce our keynote speaker, Dr. Ram Madhavan. Over to you, Dr. Hari.
Om Shri Dhanvantare Namaha. Pragnya 2020 was all about chronic kidney disease. Today, on March 3rd, 2022, we are for Pragnya 2022. This is going to deal about another major problem which is plaguing the society. And to understand to get a proper solution for the problem, we have to understand the problem better, and to explain the problem better and to give us the real picture of the current scenario in handling breast cancer. We have with us Dr. Ram Madhavan, radiation oncologist, Cancer Institute, Adayar. Dr. Ram Madhavan had completed his undergraduate in medicine from Alappuzha Medical College and did his further studies from Madras Medical College. Given his vast experience in the clinical aspects of radiology, especially in management of cancer patients, from Amrita Institute of Medical Science, Ernakulam, as well as his continuing clinical practice at Cancer Institute, Adayar, we thought it would be the most appropriate session for him to give us the real picture about breast cancer, its current scenario, advancements and challenges, and the future ahead. Over to you, sir. The stage is all yours.
Thank you.
Can I go to the next slide, or how is it, doctor?
Yeah.
Yeah, is it fine?
Yeah, it's fine. I was just trying to see whether I will be able to move it. Okay. Anyway, you will be managing, no?
I'm managing it, doctor. Is it fine?
Yeah, it's fine. It's fine.
Yeah, or else I can give you an credentials to manage it also. It's fine.
Yeah, I can. It will be easy if I will be able to.
Oh, okay, fine. I will do that. I will enable it for you. Yeah, thank you.
And meanwhile, please spotlight Dr. Ram
Yeah,
Madhavan.
I will do that. Yeah.
Yeah. So, Namaste. Is it audible? No. I am.
Very clear, doctor.
Yeah. Thank you. So I thought I will present to you the basic concepts from modern medicine point of view regarding the breast cancer, how the treatment concepts in breast cancer evolved over time, in fact over centuries in the management of breast cancer. I'm not going into the too much details of the trials and studies and all. It's in this short time I will mainly concentrate on the basic concepts in the management of breast cancer from modern medicine point of view. So it's always better to trace back the history, how the treatments have evolved over time, especially in presence of breast cancer, because so much changes has been happened since the beginning, and it helps us to identify how far we have come and how much we have to move ahead further to achieve the ultimate goal. And especially in breast cancer, so much progress has been made in the last century. So let us begin first with the, can I have my slides, please?
So you want me to share the slides?
Yeah.
You started, then doctor will be able to.
Yeah, okay. Fine, sure. I will do that, doctor. 1 second. I just deleted. I was actually sharing you. Just a second, doctor.
Yeah, it's fine.
So I will be screen sharing it, and you can tell me.
Yeah, fine.
Is it fine?
Yeah, next slide, please.
Yeah.
Yeah, so we will begin with all this history thing from this great surgeon. He's called the Halsted. He actually got trained in all these things in the 17th century. So he got trained in the Europe. His surgical skills were basically polished from the Europe, and then he got migrated to US, and he actually revolutionized the field of surgery in many solid tumors, especially breast cancers. So his basic concept was, you did a systematic surgery, means a large big surgery removing all the tumor and the surrounding structures, you will be able to cure the cancer. That was his concept. So in case of breast cancer, what Halsted did was, he removed the whole breast, the underlying muscles and the lymphatic channels, as that means it will drain into the axilla. So he removed all the fibrofatty tissue from the axilla. So that's his surgery, and we named that surgery after him, that Halsted's radical mastectomy. So his idea was, you remove the whole thing systematically, so you will be able to cure the disease. So next slide, please. So his idea was, the breast cancer, it originates in the breast and it will spread step by step, first to the entire breast, then to the surrounding lymph nodes. From there, it will spread to other parts of the body step by step. So you remove it early, the entire thing, you will be able to cure the disease. The concept is simple. That was his idea. So, and it attained success also. You are able to, so many patients got cured. But after the peak, what happens in terms of outcome? It got plateaued, because many early stage breast cancer patients were cured, but some of the early cancer patients, again the cancer came back. And obviously all advanced breast cancers, means the big tumors, after some time it showed again, that is, it came in the same place or it has spread to the other parts. So the Halsted's theory was in some way successful, but after some time it reached a plateau and it stopped there. So all the advanced cancer patients, even after surgery, they continue to die. So we need a way forward. So at that time, the next person came up. This is sometimes, so we cannot say Halsted is not true or not correct. As the Niels Bohr quoted, the opposite of a profound truth may well be another profound truth. Okay, so there comes the next slide, please. The Fisher's came. Fisher is actually not a surgeon. He's actually a physician, and his brother Fisher, that is Edward Fisher, is also a physician. He was a pathologist. So both of them did extensive research in the breast cancer, the characteristic of the breast cancer, everything, because he got a pathologist to his side. So he, cell by cell, they identified how it behaves, and finally they came up with this fantastic theory. Breast cancer is not a localized disease, means it's not something which is localized to the breast. From the beginning itself, it is a systemic disease. So you should view breast cancer as a systemic disease. So surgery means it is a local treatment. You remove a particular part, a particular tissue from your body. But breast cancer is not a local disease. It is a systemic disease. The moment we will be able to see the breast cancer, it has become systemic disease. That means you are able to see the tumor there in the breast, but the cancer cells has spread all over your body. You are not able to identify it or see it. So the moment you are able to see a tumor in the breast, it has become a systemic disease. So your local treatment alone will not work. So after your local treatment, surgery, you need to give some systemic treatment. And he introduced the concept of this chemotherapy. So after surgery, you give the patient chemotherapy. And this has actually changed. It was a great change, paradigm shift in the treatment of breast cancer. And he laid the foundation of chemotherapy after surgery. So this is the second step in the evolution of breast cancer treatment, from surgery alone to surgery plus chemotherapy. And next slide, please. Yeah. So while all these things are happening, another breakthrough was happening. Like the Madame Curie, she gifted the radiation to the science, and it led to the emergence of a new treatment modality called radiotherapy. Next slide, please. And the advantage of this radiotherapy in breast cancer is, you know, the Halsted surgery. It was a very radical surgery, and it removed everything literally from the chest, the breast, the underlying muscles, all the lymphatics. So the patients know after that they have to lead a horrible life with all this. All the axillary nodes are removed, so there will be a lot of lymphedema, literally swollen hands, and all the morbidity of surgery because chest muscles have also been gone. So what happens, this radiation is also a local modality. You are treating a particular part. So the concept was you do less surgery and compensate it with radiation. So neither you are treating the patient with surgery alone nor with radiation alone. So you will be able to combine both so that you will be able to do a more simple surgery which cause less side effect to the patient, and you compensate it with your radiation therapy. That was the concept. So from removing all the muscles and all, it came down to only removing the breast. Means only mastectomy you will do. That is, this surgeon came up with a simple mastectomy idea. Victor, he is also from the US. Next slide, please. And next slide, please. And this idea of more and more breast conservation strategies, it has opened the floodgates of this breast conservation surgeries. Then this famous person came up from Milan, Veronesi. He's also a surgeon. He was asking, why you want to remove the whole breast? We will remove only a part of the breast. The tumor along with the surrounding tissue only we will remove. No need to remove the entire breast also, because we have radiation to back up with, to compensate with. So from removing the whole chest muscles, it has come down to removing only the breast. Then it again came down to removing only a portion of the breast. Same thing happened with the axillary lymph nodes also. Why you remove the entire axillary lymph nodes? You remove only the inward nodes. So surgery has become less and less, and patients were more comfortable because less side effects, because the surgery is also coming minimized, and radiation is there for full backup. So now the surgery has been, the treatment has evolved from surgery plus chemotherapy, and then there is radiation therapy. So that is the standard protocol from surgery alone. Okay, next slide, please. Next slide. Next slide. Yeah. So we have reached up to a stage where the treatment is surgery, then you will give chemotherapy, then you will give radiation therapy. Then came another shift in the treatment of breast cancer. This standard treatment protocol works well for early breast cancer. But what about patients presented with large tumors virtually involving the whole breast? So such patients, this Edward introduced the concept of neoadjuvant chemotherapy. Instead of giving chemotherapy after surgery, you give chemotherapy first. That will help to shrink the tumor, and it will help to destroy the cells in the cancer cells in the bloodstream. Also, this will help the cancer cells spillage during the surgery. So give chemotherapy first, knock out the potential of the cancer, the spreading potential of the cancer cells, shrink nicely, and then do surgery followed by radiation therapy. This works well for large tumors. But for small tumors, the old concept works well: surgery, chemo, radiation. But for large tumors, give chemotherapy then surgery, then radiation. So that works well for larger tumors. Next slide, please. Next slide. Yeah, we are talking all about Europeans and Americans. See, there are great things happening here in India, in Chennai, where the pioneers like Krishnamurti sir and Shanta madam. See, we here in those days when they started treatment in our Indian scenario, they were confronted with virtually large tumors replacing the entire breast. So you can't think about surgery and all. So Madam Shanta and Krishnamurti sir introduced this concept. Why don't you give chemo alone? You give chemotherapy and radiation therapy together to such large tumors so that it will downsize. It can downsize the tumors will shrink nicely, and then you make it operable. You do surgery. So that works well for them. Okay. So these are the various concepts in modern medicine cancer for the breast cancer treatment. Next slide, please. Now, but how we reach but have we reached the final stage? No, the watershed moment in the treatment of breast cancer has just begun. Like it is a molecular and genomic profiling of the breast cancer. See, you have seen a lot of breast cancer patients, but all tumors are not behaving in the similar fashion. You will give the same treatment to them, same looks like same tumor, but some will be cured, some immediately after, some will not respond at all. The tumor virtually laugh at you, means it won't respond at all. And some, what happens, after some time it will come back. Some patients after a long time it will come back, and this comeback also sometimes it come back in the same area, sometimes it spread in the different. So all tumors, even though look same, they are not the same. Each cancer is different, each cancer is individualistic. So how, if only if you able to identify the individual tumor profile through molecular and genomic profile, you will be able to target them better. This concept has actually, this is the watershed moment, and we started targeted therapy in this century in the treatment of breast cancer. For example, if estrogen receptor positive, you will give drugs to that. After the surgery, chemo and radiation, you will give tamoxifen tablet or a letrozole tablet that target that estrogen progesterone receptors for a period of 5 years or 10 years. Like that, if HER2 positive, another receptor, molecular receptor is positive, HER2 gene is amplified, you will give targeted therapy against that along with the standard treatment, which will help to deal with those tumors better. So the journey has just begun only. We have to go a long way. So this is the era of targeted therapy, which will help us further to move ahead. Next slide, please. But still, we are dealing with the same challenges that I have told. Like some are cured, some will come back in the same place or different place sooner or later. So only through this understanding the individual tumors by molecular and genomic profiling, that is the way ahead as far as modern medicine outlook is concerned. Next slide, please. Now, how can we integrate things with other disciplines? See, we all know India is a treasure trove of all medicinal herbs. Which Loka shows, Nasti Moolam Anaushadham, means there is no medicine, no medicinal herb which doesn't have a value, medicinal value. The problem lies in identifying the correct medicinal values and knowing how to join together various drugs to achieve the desired goal. So as far as India is concerned, we are lacking neither in resources nor in the talent. Next slide, please. This is an example, paclitaxel. It's a most important chemotherapy, most widely used chemotherapeutic drug in the paclitaxel. This has been derived from the bark of a Pacific yew tree. Actually, this National Cancer Institute, that is US people funded it, and involved in this breakthrough research, one Indian also, Mansukh Wani is also there, along with his colleague Monwal. They discovered this molecule paclitaxel from the bark of Pacific yew tree. This is one example. So we need to discover more and more drugs which are effective in the treatment of cancer treatment. And as far as India is concerned, we are blessed with all the medicinal herbs. We need to identify it. Next slide, please. This another avenue where this integrated approach will work is this one. This is an example, like to provide a healing touch. Whether radiation is concerned or chemotherapy is concerned, there are a lot of side effects. So we need to identify the side effects and how to help us. This is example of one trial we are going to start with Dr. Hari Krishnan as the principal coordinator, principal investigator in Cancer Institute. Is after radiation in head and neck patients, there will be a lot of dryness of the mouth. So the patient has difficulty in swallowing. See, saliva is a key component. Once it is down, they will be having a lot of infections. So how can we prevent, or how can we decrease the dryness of the mouth? So they have come up with this tablet, wonderful tablet with Madhu as the key ingredient. And we are going to start. So this is another avenue where integrated medicines identify the side effects and how to help the patients to improve the quality of life. The next slide, please. This is the another avenue where we can have a lot of scope for alternative medicine is chemo prevention. Like some patients are high risk for certain cancers. So you will give some drugs to prevent cancer developing in those patients. That is primary prevention. Second is secondary prevention, means already there is a lesion. At present, it is not cancerous, but it has the potential to become cancer in the future. So how will we be able to arrest the development of cancer in those patients? That is secondary prevention. And tertiary prevention is already cancer has come. We have treated it. Now they are disease free. But how to prevent cancer recurs, the same cancer recur back, or they are prone for another multiple cancers. So from how can we prevent other cancers from developing? That is tertiary prevention. So there our medicines have a lot of and already this turmeric, this curcumin has made it into the list for chemo prevention. So like that, simple, easy resources we can find out. Next slide, please. So the way ahead is an integrated and holistic approach. The compartmentalization of knowledge will no longer work in the contemporary era or in the future. Like I am also coming from Kerala with a lot of Ayurvedic and Sanskrit, all those backgrounds. So the basic, the Ayurveda, Veda, the term Veda comes from the root word Vijnane, means the knowledge. So Ayurveda literally means the knowledge about life science. So whether it comes from what we call as, we divide things like modern medicine, Ayurveda, Siddha, homeopathy, based on for our convenience. But knowledge doesn't have any compartmentalization. Any knowledge about life is actually literally Ayurveda. So we need an integrated, holistic approach, need to be open to each other and find a way to help the patients. Next slide, please. So I just conclude with the first slide, how we arrived at, no, we have not arrived. We still have miles to go before, and we all need to be together. Only then we can arrive the ultimate directions. And I just rushed because of lack of time. Thank you all.
Thank you, doctor. Thank you, doctor. Thank you so much for yeah. Sorry. So thank you, doctor, actually for stating the salient differences between the surgery, chemotherapy and radiation. And as you rightly pointed out, the key is for us to identify the right kind of medicinal herbs and utilize them that can minimize the side effects. And the integrated approach of treatment is the right way to go, like you said. So I think these kind of webinars could be one step towards that exercise. So now we can proceed over with our plenary sections. Okay. Now, with that note, I would like to call upon Dr. Vaijayanti to introduce our first plenary session speaker, Dr. Bharati Kumaramangalam. Dr. Vaijayanti, over to you, please.
Thanks once again, Akshaya. It's my honor and privilege to introduce to you all my guru in Prasuti Tantra and Stree Roga, Dr. Bharati Kumaramangalam. Dr. Bharati Kumaramangalam has earned her BAMS degree from SV Ayurveda College, Tirupati, and her master's degree in Prasuti Tantra and Stree Roga from BHU Varanasi. She has also completed her PhD from National Institute of Ayurveda, Jaipur, and has to her academic credits a diploma in nutrition and health education, course credits in yoga, Sanskrit, and Hindi. Throughout her illustrious career spanning over 2 decades, she has worked as a research officer in CCRAS, served as a lecturer and physician in SDM College of Ayurveda, Hassan, and SJSAC, Chennai. She currently heads the Department of Prasuti Tantra and Stree Roga at National Institute of Ayurveda, Jaipur. Her publication repertoire includes numerous conference papers at national and international levels, an academic book on Prasuti Tantra, a book in Telugu titled Bhallataka Amritam, and an English translation of Bhopadeva Samhita. Welcome, ma'am. It's an immense pleasure to welcome you once again. The session is yours.
Thank you, Dr. Vaijayanti. My humble pranamas to all the learned persons who gathered here. I would like to thank the organizers at the outside for giving me this opportunity. Whatever little knowledge I have to share with you. I hope my screen is visible.
Yes, yes, doctor.
Okay.
Ma'am.
So, as Sir was telling my previous speaker, that this is a land of Ayurveda, and we have many systems to go together for giving finally the relief to the patient. So that is the target for every doctor, I believe. So what Ayurveda can do in breast cancer. So as like other disease conditions in Ayurveda also, the description is there about the tumors, maybe the benign or the malignant tumors under the chapter Arbuda. Arbuda denotes both the benign as well as malignant tumors, and Rakta Arbuda and Mamsa Arbuda particularly, they come under the malignant ones. So breast cancer, we can consider it as the Stanagata Rakta Arbuda. So,
Doctor, may I request you to put it on the PPT mode for a better
Slideshow.
Slideshow. Yeah.
I have started this slideshow only.
No, there is.
Oh, ma'am, probably the screen is reflecting the PowerPoint, ma'am. If you click the screen, you can see that it's showing the wrong screen, ma'am.
Full screen, madam.
We want a full screen. Akshay, can you help doctor do it?
Yeah, ma'am, actually, if you, in the Zoom window, if you just click share screen, you'll be able to see the screen that we are sharing. So it's still in the PowerPoint, although you have pressed the slideshow.
Okay. I don't know exactly, but
if it's all right with you, can we screen share? Can we screen share on behalf of you? If it's all right with you?
Oh, yes.
Yeah,
I can do it.
Thank you.
So I will screen share it, ma'am. On
Yeah.
Okay.
1 second. screen seen?
Yes, yes.
Yeah, perfect.
I think so. You can start, ma'am, your presentation.
Yeah, okay. So next slide, please. I think you can skip 2 slides.
Skip 2 slides.
Yeah.
It's still there.
Even the overview also?
Oh yes.
Dr. Arbuda. Yeah.
Yeah.
Yeah, but I think
Yeah.
so.
Yeah. That's okay. It's okay. So well, slokas are not anyway. No issues.
Or else,
Can we manage without slideshow, sir? Can we ask ma'am to present it? Because shlokas will be gone otherwise.
You can still continue the slide, no matter if slokas are not displayed. Please.
Okay.
continue. Yeah.
Right. Okay, sir. That's fine. So the Arbuda is nothing but the literal meaning is a round, large mass that is Arbuda. Means the any swelling that is round in contour and the huge in volume, then that is considered under the Arbuda. Next, please. So Ayurveda believes that Rajas is the regulating factor for the growth of the sthana, that is the breast. So Rajas is the entire physiological aspects that are related with the formation of the endometrium and ovulation and all the surrounding physiology comes under the Rajas formation. And during the menarche, as soon as onset of Rajas is there, then that is paving the way for the growth of the breast. So there is interrelation between the Rajas and the growth and other pathology of the sthana. So yeah. So Susrita, as you all know that there are surgery for the entire world, I say. So he is the first person mentioned about the Arbudagnya, means the tumor specialist is there. So he will look after all these Arbuda conditions since he is from the Shalya background, that is, he is from the school of surgery. So involvement of Ayurveda believes fundamentally in 7 kinds of body tissues, starting from the Rasadhatu, Raktadhatu, Medas and Mamsa, Majja, etc. 7 dhatus are there. In this particular Arbuda condition, Rakta, Medas and Mamsa tissues involvement is there according to Ayurveda. Next, please. So it is described under the Apache. There are the chapterizations are there about the Arbuda, and for more clear definition that we can have from the Bela Samhita, the contemporary of the Acharya Saraka from the school of Atreya. Arbuda is a tumor. Majority with the muscle tissues. And
Sorry. Can you please mute
Anu, please
Dr.
mute yourself.
Dr. Anu and Dr. Anand? Can you please mute yourself?
as a host, I'm muting everyone. Kindly unmute yourself, speaker, and you can go ahead. Sorry.
Next slide, please. So Raktarbuda, that is the truly cancerous growth having different samprapti, that is pathogenesis. Samprapti is the pathogenesis. So aggravated dosha after pressing and constricting the blood vessels vitiates the blood and causes the Raktarbuda. That is the pathogenesis behind the formation of the cancer as far as Ayurveda is concerned. And for the appearance, it appears as a fleshy lump, separating in nature, discharging, galloping, and it is covered with the many number of fleshy sprouts, and that discharges vitiated blood constantly. So this description, if we observe with the advanced stages of the cancer, we can compare it. Next, please. So, and you know that the cancer is the result of the mutation in the cell, very rarely single mutation. Of course, I'm not going into details of this. What I mean to say, the further the prevention and all, based on the gene mutations, based on the preventive aspects mentioned in Ayurveda, is going to prevent these kind of gene mutations. Like so many paricharyas are there, particularly with the female. So that we are going to have. Next, please. So causes for mutations, there are so many factors mentioned, and these factors are laid down in Charaka Samhita. So how any swelling is initiating. So few factors I have mentioned here. That is an elaborate list of Nidana mentioned in Charaka Samhita. So some are related directly with the breast cancer are shown here. That is the Madhya. Madhya Sevana is considered as the in Charaka Samhita period itself, Madhya Sevana is considered as the for the Sota and the Arbuda. So research also showing that the drinking of alcoholic beverages and hormone receptor positive breast cancer, that prevalence is increasing with a woman who is having the habit of the alcohol drinking, and so 15% higher risk of breast cancer is seen. The women who have 3 alcoholic drinks per week. Next, please. Sutika Mithya Upachara. So I said that there are some particular Upachara described for the woman at each phase of the reproductive life. So like the Rajaswala Paricharya, Prasava Paricharya, Garbhini Masik Paricharya, and Sutika Paricharya. So these are very key paricharyas for the woman to prevent this kind of disorders. So one among them is the Sutika Mithya Upachara. Adoption of the Mithya Upachara, abnormal lifestyle after the delivery, is a very important issue as far as breast cancer is concerned. So in Prajata Sri, purpureal woman, if the woman is following this abnormal lifestyle, then that may be causing the dense breast possibility, and these dense breasts are the risk factors for developing the breast cancer. Next, please. Next, please. And of course, Navashukan is one of the important Nidana factors, causative factors for the Arbuda. So that is the high sugar intake and breast cancer relation is established. So Navashukadanya intake is condemned in Samhitas, but right now we are following it. We do not know which kind of Dhanya we are getting, and we are purchasing from the stores and we are consuming. But in the wake of the India becoming the diabetes capital, the people thinking, they started thinking, changing to the old grains, but still many of the people, they don't have the access to get the old grains. So this is again one of the factors important for the development of the breast cancer. Next, please. And Pradara, that is menorrhagia, is one of the, according to Charaka, causative, endogenous causative factor for the edema. That is Sota or any kind of swelling, we can say Nija Sota. Pradara, that is menorrhagia, and that is linked with the breast cancer. Menstrual life and breast cancer, we know very well. I think we can skip. Next, please. Next. So coming to the management of the breast cancer. Anyway, we know majority of the risk factors and how the breast cancer is initiating, and we are constantly putting all the medical fraternity, their efforts to ask the woman to check periodically and undergo every year mammography and all. But as far as management is concerned, that is very important. With the advancement of all those techniques, still majority of the women, they are dying with the breast cancer. So in that case, when they follow, when we create the awareness about the Ayurveda, we can, I think, prevent majority of the breast cancer cases. We'll see how we can go for the prevention. Next slide, please. So Rajaswala Charya, we know in the particularly South India, the custom was there. First 3 days, the woman was not allowed to go outside. But we people, we constantly, we were feeling that is a social taboo, and we were fighting with the society and with the family also. Please let us go outside. But that is not the correct way. Rajaswala Charya, the woman has to follow. First 3 days are very important. As far as the healing and stem cells that are present in the basal endometrium. So when we are allowing to heal properly the functional endometrium repair during those 3 days, and that is allowing to prevent majority of the diseases. So Rajaswala Charya is very much important. It is comprising the diet as well as the lifestyle also, Rajaswala Paricharya. And the next is the Rutumati Charya. When woman is planning for when couple are planning for the delivery, that time also Rutumati Paricharya, particularly they have to follow. And of course, Sutika Paricharya, and strictly follow the general Rutucharya seasonal regimen laid down in the Samhitas. According to each season, we have to undergo Shodhana, detoxification of the body that prevents the multiple gene mutations. So by and large, we can prevent all kind of cancers. And menopause, we have to ask the woman to take the Rasayana therapy. So Rasayana therapy is a particular therapy mentioned to start Purve Vaisi Madhyeva. At least in the middle age, the woman has to start the intake of the Rasayana. This is again according to the seasons. Say suppose Ashwagandha during the winter season, you ask them to take for 3 months. Like the summer season, then you ask her to take the Shetavari. So like that, each quadrant you can shift the Rasayana. There are 4 major Rasayanas important as far as the female health is concerned. Ashwagandha, Shetavari, Amlaki, and Eshti Madhu. Sarva was telling about the Eshti Madhu. So Eshti Madhu is one of the important Rasayana. It maintains the host defense. So thus, there was a Nobel Prize that when immune deficiency state is there, then there is a high possibility for the development of the cancer. So when the woman is able to take the Rasayana, I think we can prevent the onset of these kind of cancers during the menopausal age. So under prompt treatment of the different yoni-vapors that are causing the carcinoma conditions and different Ashrudhara and Arthadushti also, right time we have to manage them. So I think we can prevent the next, please. So I was talking about the Rajaswala Paricharya. So what is the Paricharya? That should be started as soon as the girl starts menstruating. That is from the menarche to active, till the completion of the active reproductive life. The woman has to follow this Paricharya. During first 3 days, she has to take the diet comprising the barley with the milk, cooked in the milk and added with the mishri, not the sulfurated sugar, but she has to add the mishri. We have to promote the use of mishri in the domestic level also. And otherwise, ever barley is not the staple food of that particular reason, then we can ask them to take the Sashtika Shali cooked in the milk and adding with the mishri. So there are 2 options, and complete rest in those 3 days, and she has to avoid even the makeup and all, even the cut of the nails. This kind of minute lifestyle modifications are suggested in the Samhitas for the woman. I believe these has lot help the woman to prevent majority of the even the gynecological diseases. Next, please. And Rutumati Charya, so there are different suggestions for the aphrodisiacs and the food, and food should comprise for the male and female. There are different preparations suggested for them, so that they can adequately maintain the physiology, Rajas Nirmana, and to achieve the good pregnancy. Consequently, maintaining the physiology during the pregnancy as well as post-pregnancy. Next, please. So Tila is one of the things suggested to take for the Ritumati. Next, please. So coming to the components of the proper management of the Arbuda with the special reference to the breast cancer. So yoga, you have to add with that drug and the diet and lifestyle. Next, please. So as Ayurveda believes that first we have to, if these kind of grave diseases, first we have to subject them for the purification. The entire body purification they have to undergo. So it starts with the Vamana and Virechana. Vamana is the therapeutic emesis and Virechana is the therapeutic purgation. So whatever the chemical messengers are there that is enhancing the growth inside the body in a bulk that will be expelling out from the body, there is a particular schedule is there. Gritapana means the intake of the ghee for the 5 to 7 days, followed by the whole Vedana. Then we subject them for the therapeutic emesis, followed by Samsarjana. There is a diet schedule. Followed by therapeutic purgation, they have to undergo again. And after that, we can subject them for the Shamana, that is classification therapy. So that again, Shamana therapy, drugs will give herbomineral drugs and herbal drugs. As far as Arbuda, the cancer conditions are concerned, we have to prescribe the herbomineral drugs. With the simple herbal drugs, it is difficult to control the growth of the cancer. Next, please. So, for the Shodhana Karma, for detoxification of the body, Deepana Pachana, first we'll start the Deepana Pachana procedure for giving 3 to 5 days according to the Agni status of that particular individual. We'll see the metabolic state of that individual, and then we ask them to take 3 to 5 days Deepana Pachana drugs like the it differs, these drugs differs with the individual's practice. Some people they use a Chitrakadi, some people Panchakola Churna, something. So in our institute, National Institute of Ayurveda, we follow the Panchakola Churna from the Department of Prasuti. Our practice is the giving the Panchakola Churna for 3 to 5 days, and followed by plain gruta, ghee, pana, or medicated ghee. We ask them according to the disease condition. So in this condition of the cancer, Panchatikta Gugulu or simple Gogruta is enough to Snehapana. After the Snehapana, we'll assess the patient whether they got the Snigdha Lakshana, Samyak Snigdha Lakshana. Then we subject them for the Sarvanga, Snehana and Abhyanga. So after that, we'll induce the therapeutic emesis, subjecting the patient for the Kaphotklesa, and then same schedule repeated for the Virechana. Next, please. For the Vamana, Madanaphala Churna, the usual practice with the Vacha Churna and Pipali Churna, Saindava. So there are the standard protocols for the Vamana as well as the Virechana. Virechana usually we induce with the Tribhuta Valiha or Gandharvastadi, or according to the Abhayadi Modaka, whatever they practice that we can adapt Virechana. Next, please. So one doubt you get that cancer patients, usually they are already depressed condition, and they cachexia is the prominent in them. So in that conditions, you have to assess the general status of the Agni and the vitals of the patient, then prepare for the Vamana and Virechana. So under the expert guidance, this should be done, and if not possible, at least put them on the Sadhya Virechana or Nitya Virechana. So Nitya Virechana safe practice is the Avipatikara Churna. For the Nitya Virechana, we can add daily, we can give 6 grams. So continuously that Virechana process, but in small doses, that is continuing. So next, please. And then Vasti, we can perform. Vasti is the therapeutic enema. We perform according to the conditions. In these cases, you may get the doubt why Vasti. So according to Ayurveda, the Apana Vayu, the Vayu that is situated, governing the functions of entire pelvic cavity is governed by the Apana Vayu. Through the Vasti, when we control that Apana Vayu, so Rajas Nirmana will be proper and Rajas will not give pathological stimulations to the breast. Next, please. And rasa preparations, what we use in cases of the cancer, these are available plenty. Dabur, Patanjali, and all the companies, they are manufacturing this. The first one is the Vajra Basma. That is the Basma nano powders of the diamond we can use along with the combinations of the Shila Sindhura Basma, Vriddhi Badika Vati, or if Vajra Basma is not available, then Vaikranta Basma we can give along with the Kanchana Gugulo and Pravala Basma. So the combination you can prepare and ask the patient to take, but you have to check about the gastritis, etc. Next, please. Vriddhi Badika Vati. So this is again a metallic preparation containing the mercury, sulfur, iron, and Vanga Tamra, Kansya. So many the metals are in the Basma form, incinerated nanoparticle form. These Basmas are. So we use this Vriddhi Badika Vati not only in cases of the cancer, in cases of the fibroid also we use these preparations. Next, please. Shila Sindur, again, this is a Basma. So this is containing the Parada, Gandhaka, and Manasila. Arsenic preparations are approved from the FDA of America in the management of the cancer. So they are using in the leukemia and the cervical cancer, etc. So in Ayurveda, we have this Sindur preparations containing the, arsenic preparations are there. We can use it. Shila Sindur. Next, please. Vaikranta Basma. This is the substitute for the Vajra. So when we are not getting the Basma of the diamond, then we can use the Basma of the tourmaline, that what we call in Ayurveda is the Vaikranta Basma. So it is containing the iron and the silica as a major constituents. As for chemical composition, these are, we have nothing to do with that. Next, please. So, of course, one rasayana you have to add, or combination of rasayana according to the Deha Prakriti and the season, you can add rasayanas while giving the treatment also for the cancer. Next. And yoga, it is established practices of yoga are there. We can ask the cancer patients to perform the whatever feasible yogasana they can able to, and along with the dhyana, that is very much helping in the cancer patients as a Sattva Chikitsa. Next, please. So research on the breast cancer and Ayurveda. Sir was telling that many of the herbs are found working in cases of the breast cancer. So let's see what are those herbs available for the treatment of the cancer. Next, please. I was telling that with the advances in the treatment modalities also, in the current scenario, the incidence of disease is not coming down, nor the mortality coming down, right? So as Sir said that integration is the only way we have to adapt. So currently available anti-cancer drugs, they are exhibiting limited efficacy, but we don't have other ways, so we are depending on them. But it is our duty to explore the additional support from the traditional systems. So they are also having severe side effects and are also expensive. So if the cost basis also, if you see, we can add the Ayurvedic drugs in the management of the cancer. Next, please. So as an adjuvant therapy, Sir was telling about the curcumin. Curcumin was tried in cases of the advanced or metastatic breast cancer patients and compared with the docetaxel. And in this, curcumin was orally given in 500 mg. The curcumin is the extract of the curcumalanga, active principle of the turmeric. In the dose of 500 mg per day for 7 consecutive days by cycle D-4 to D+2 and escalated until a dose limiting toxicity should occur. So they have checked even the toxicity also, dose stabilizing activity also they have done. Next, please. Their primary objective to determine the maximal tolerated dose of the combination of dose escalating curcumin and standard dose of the docetaxel chemotherapy in advanced and metastatic breast cancer patients. And secondary objective about the toxicity, safety, and vascular endothelial growth factor and tumor markers measurement, objective, and clinical responses to the combination therapy. Next, please. So in the result, the last dose level of curcumin 3 dose limiting toxicities were observed, and 2 out of 3 patients at this dose level refused to continue the treatment. So this led to the researchers its maximal tolerated dose of curcumin. They arrived to the conclusion 8,000 mg per day can be given in the form of curcumin. I am not talking about the form of haridra. This is for the curcumin. And conclusion, efficacy of the drug was enhanced. The recommended dose of curcumin is 6,000 mg for 7 consecutive days along with the docetaxel. Next, please. So in study 2, clinical trial was carried out to assess the ability of the curcumin to reduce the radiation dermatitis severity in 30 breast cancer patients. So it was a randomized double-blind placebo-controlled trial, and criteria of inclusion: non-inflammatory breast cancer, carcinoma in situ, prescribed radiotherapy without concurrent chemotherapy cases were taken into the trial, and trial drugs randomized patients took 2 grams of the curcumin here or placebo orally 3 times per day. Next, please. So assessment done based on the radiation dermatitis severity score, RDS score, and presence of moist, disformation, redness measurement, McGill pain questionnaire, short form, and symptom inventory questionnaire they have done. And demography 30, evaluable patients primarily of white origin 90%, with a mean age of 58 years. They have seen the demography in the trial subjects. Next, please. So standard pooled variance test they have carried out, and that showed that the curcumin reduced the RDS at the end of the treatment compared to placebo. So when the patients are subjecting to the radiotherapy, so when we are adding the curcumin, simple curcumin, so that is bringing down the radiation dermatitis. So in that way also curcumin is helpful in breast cancer cases. Next, please. So another clinical study done with the Bugulu in the management of Ayurveda with reference to the breast cancer. Sample size was 0.8. This study long back they have done. So sample size was so small. So 2 groups they have divided. One is comprising the signs and symptoms of Stanarbuda, had undergone the known anti-cancerous treatment like the chemotherapy, radiation, and surgery. Group 2 they have taken with all positive signs and symptoms, but who had not undergone any treatment like the surgery, radiation, and the chemotherapy. So they have given both the groups. They have given Shuddha Bugulu 4 grams daily in divided dose with lukewarm water. So the total effect of the drug in group 1 was 60%, whereas in group 2 33.3%. So the combination is establishing the necessity of the integration in the management of the cancer. Next. So this study was done by Dr. R.K. Sharma and Kulwant Singh sir from Jamnagar. Okay, I'll show the later. The video, I missed it. Agni Karma, we are performing the periphery of the breast to prevent the metastasis of the breast cancer with the simple shalaka. Next, please. This video is missed here. So there are some single and compound herbal drugs. They have efficacy in the breast cancer. Next, please. So Karpumalanga, the first one, we had a discussion, and it is established on the animal models also, animal studies also. This is helpful in the prevention of spread of the breast cancer in its tracks.
Hello.
Next, please. Next. inhibition of metastasis. Curcumin is also helpful in the inhibition of the metastasis. So it exhibited number of anti-cancer activities on pharmacological studies. So there are different ways to manage the cancer. We know that. So here the curcumin is inhibiting the metastasis through its ability to suppress the nuclear factor kappa B, and it has got other anti-cancer activities also. It is helpful in the promotion of the apoptosis in the cell, and in potentiating the effects of other forms of chemotherapy and inhibiting the angiogenesis. So these are important key pathways when we talk about the cancer management. Next, please. So curcumin abrogated the sir was telling plaquettac cell induced nuclear factor kappa B activation in the breast cancer cells and inhibited lung metastasis even in breast cancer cases on the mouse model. Next, please.
Doctor, Dr. One, I think we are overshot by 30 minutes. I think you are nearing the.
Yes, sir. I'm nearing to the conclusion.
Okay,
Yeah,
because two more presentations.
Yes, sure, sir. Yeah.
We don't have what to stop you because it's such a wonderful, enlightening session. But I just want to remind you about the time constraint. Sorry about it. Sorry.
No, sir. No problem. So, well-controlled clinical trial on patients of very high-risk pre-malignant lesions done with the curcumin for 3 months also shown the encouraging results in cases of the cervical neoplasm also. Next, please. Semicarpus anacardium. Another the promising drug studies done from the Tamil Nadu. I think Dr. Prema and some other authors, they have reported, they have published a number of papers on the anacardium and the prevention of the management of the breast cancer. Its cytotoxicity established beyond doubt, and in BHE also so many studies done. Next slide, please. So the pathways of this thing is triggering the apoptosis signals in some cancer cell lines. They have done the studies and established that it is triggering the apoptosis in the cancer cases. Next, please. So this is the picture. Next, please. Ashwagandha, it is also, we know that very well, as leaf extract has been shown to produce anti-proliferative activity in the breast cancer cell line studies. Next, please. Vitaferin A, the extract from the marker compound or the active principle of the leaf of the ashwagandha, and as well as from the root it is extracted. It is also having inhibition property and the growth of the MCF7 cell lines in the culture, and MDA xenografts in vivo also. It has shown promising effect as apoptosis, apoptotic agent. Next, please. Chemo prevention. Sir was talking about the chemo prevention. So the trial done for the chemo prevention on the Vithania somnifera, and it was observed that the incidence, multiplicity, and burden of the breast cancer in rats were decreased by the vitaferin ashwagandha administration. Next, please. So as a chemo preventive agent, we can use the ashwagandha. So next, please. So we can skip. This is a result and statistic about the influence of the vitaferin A in the breast cancer cases. Next. So in vivo study also established that it is preventing the metastasis. Ashwagandha is preventing the metastasis of the breast cancer. Picture of ashwagandha. Next, please. Amura rohitaka, another the promising drug. So many studies done in the Institute of Medical Sciences, Banaras Hindu University, on the Amura rohitaka. One of the pet drug of Dr. G.C. Prasad. They have done so many studies in collaboration with the oncology unit in the Banaras Hindu University, and the drug is also very much in the management of the cancer. Next, please. So the picture of the Amura rohitaka. Cedrus deodara. Deodara is also having the effect against the breast cancer. Next, please. the picture of the Devadaru. So another important issue is the nanoparticles and delivering of the drug directly to the site of the cancer. So thus we can prevent side effects of the cytotoxic drugs. So the nanoparticles of the silver as well as the gold trials are done, and they also showed the promising effect of at the site drug delivery. So in this study, the berberine extracts were delivered through the silver nanoparticles, and they achieved good cancer growth arrest. Next, please. So silver nanoparticles as a carriers they have done to deliver the berberine active principle of the berberis aristata at the cancer site. So and their data suggested that the anti-cancer activity of berberine is linked to the downregulation of adenosine monophosphate activated protein kinase AMPK and hypoxia inducing inducible factor 1 alpha. So through these pathways, berberine is acting against the cancer. Next, please. So silver nanoparticle and breast cancer. So they have observed that the with the berberine silver nanoparticles, they observed that the tumor volume and weight by inhibiting the MCF7 cells proliferation done with the berberine. Next, please. So this is a picture of the berberine nanoparticles with the silver. Next. So even in MDR cases, this is a point of concern. MDR cases are increasing in the cancer, multi-drug resistant. So there also, so that drug resistance can be escaped by administering these drugs to the neosomes to deliver the active drug. Next, please. So Google, I have shown. Next, please. You can skip this slide. So there are other drugs also they found active against the breast cancer, like the Curculigo-archaeidis, Mushali, and Citrullus colocynthus indravarani, and Berberis vulgaris, and Asimum gratissimum. Next, please. So even the compound drug trials were done by Dr. G.C. Prasad. Compound drugs containing the again Ballataka and Amura Rohitaka and Ht Madhu and Tamravasma. So this is also a good study. They have carried out clinically as well as animal studies, both the studies. Next slide, please. The combination of drugs, they have seen that the chemo, radio, and Ayurvedic drug combination worked well in cases of the cancer patients. Next, please. So the take-home message is the integration is the it should be our top priority. We have to integrate all the systems. Finally, we have to give relief from the cancer cases. So even world needs support from Ayurveda or other traditional systems of medicine in combating the cancer. Next, please. So with the periwinkle picture, I thank you all for giving me this opportunity and for listening me. Thank you.
Thank you, ma'am. Thank you so much.
Thank you, Doctor, for your enlightening speech on the Ayurvedic basis and various treatment plans for breast cancer. I'm sure the participants are richly benefited from your valuable inputs today. So moving on now, I would like to call upon Dr. M. Harikrishnan to introduce our next speaker, Dr. C. Arul Vasu.
Dr. C. Arul Vasu is the Honorary Director and Coordinator at Envis Center, also the Associate Professor at Zoology Department, University of Madras, Chennai. Dr. C. Arul Vasu specializes in cancer biology, biomolecules and biomedical applications, as well as aquaculture nutrition. Sir has received the Young Scientist Award for Best Paper Presentation, has done Best Indian Science Research Nanotherapy for Breast Cancer by Nature Publishing Group. He has published in Nature Publishing Group about breast cancer. Sir has around 2 patents to his credit. He has presented papers in various national and international seminars. He has published in various international journals. He is a life member in Indian Academy of Neurosciences, Ecotoxicology and Hematology, member in Indian Society of Hematology and Ecotoxicology. And he is also a member in European Association for Cancer Research. So Sir has a big list of achievements to his credit. And without any further delay, I cordially invite Dr. C. Vasu to present us on the topic biomolecules in the research and development of treatment against breast cancer.
Thank you, sir. Thank you for your nice introduction, sir. Thank you. Can I share my slide?
Yes, please, you can.
Yes.
Is Dr. Vasu muted?
Doctor, are you on mute? You're on mute.
Dr. Arun Vasu, I think.
Yeah.
Doctor, you can unmute yourself.
He did. So, yeah.
Sir, are you able to
Are you
hear
very
me?
audible?
Yes.
Yes, sir.
Yes. So my topic is a natural product as a source of bioactive molecules in cancer research and treatment. So I'm coming from university. So sir and ma'am already discussed about the cancer and the treatments, various treatments and other thing. So I wanted to share my what we are doing in the cancer biology, in particularly breast cancer. We will discuss one by one. Before that, a small introduction about the cancer biology. Just I wind up, I know the timing and the thing. So cancer, you know well about the cancer is a disease characterized by the uncontrolled, irreversible, independent, autonomous, uncoordinated, unlimited, and also abnormal overgrowth of tissue. So there are two types of benign and as well as malignant tumor. I don't want to go much about this. Sir already explained the different types of cancer also. Ma'am also explained. So causes of cancer. So genetical causes of cancer is 5 to 10%. Then 90 to 95% of the cancer is an environment. Environment in the sense diet, alcohol, obesity, infection, and all those things comes under the environment. So most of the part is in environmental characteristics. There are different types of cancer based on the origin as well as location of the cancer. Again, classified into various ways. So because of the origin of epithelial cancer, originated cancer called as carcinoma, like that leukemia, lymphoma, melanoma, sarcoma. So where actually originated and where is it located in the things. Here you can see the various types of cancer. This is the current statistics of cancer throughout worldwide. You can see the both male and female as a 2020 data. Lung cancer nearly about 14%, 14.3%. Prostate cancer 14.1%. Colorectal cancer, like that, male population is slightly increasing year by year. At the same time, female, you can see the breast cancer level 24.5%, number one position in that. So every year the cancer statistics, cancer level of cancer and is increasing. So here you can see the estimation number of death worldwide also increasing. So from the age 0 to 74. So this slide mainly emphasizes what is the current statistics of throughout worldwide, both male and female. So every year increasing the cancer level and also death also increasing. This is cancer statistic in India, both male and female. So here also almost same to the throughout world thing. So breast cancer is still number one in position because of the various category we will discuss on later. Below that thing is a summarize the statistics, overall statistics. You can see the book and any reference, you can easily understand. So this is the current statistics of Indian cancer statistics. So sir and ma'am already discussed. There are three major treatment therapy: radiotherapy, chemotherapy, and surgery. So surgery and radiotherapy, 1/3 of the patient can be effective when tumor has not metastasis. So once they are not reaching the metastatic stage, there is a third stage. So it will be useful for things. Chemotherapy, 50% of the patient can be treated with the chemotherapy, contributing to cure in 15 to 20%. So immunotherapy is also some side effect. That means overstimulation, misdirection of immune system, like that. So different side effects also there. Then hormonal therapy, infertility leads to, sometimes it leads to infertility problem. And targeted therapy, it develop resistance. So nowadays very clever, tumor cells are very clever. So developing the resistance also. Then bone marrow transplantation is also having some problem, changes to gain new cancer. Sometimes it leads to new cancer also. Then needed for novel anti-cancer drugs from natural sources. So nowadays, scientists and researchers more concentrate about the novel drugs from natural sources because of the side effect and also resistant purposes. FDA, Food and Administration approved by drugs have the potential to be very harmful unless they are specific to cancer cell. Number one. Number two, development of multi-drug resistant in patients. Okay, that's also developed. You know the things, you can see the newspaper daily. So multi-drug resistance. Then long-term treatment, severe side effects. It leads to severe side effects of the available drugs. Thus, the needed for novel drugs to treat malignant tumor is still required. So that's why most of the scientists concerned about the natural drugs for the treatment of cancer, all cancer. So because of why we are selecting in the marine organism for that, because of I'm from a zoology background, so I have selected the marine organism for the drug development. So why? Because of the product or defense mechanism. Most of the animals use their bioactive compounds for reproduction purposes, communication purposes, protect against predator and also infection. So we have to isolate the bioactive compound from the marine organism used as a drug for the treatment of various cancer. So these are the available drugs from marine approved. Some of the drugs were approved from the marine organism. These are the drugs from that is purified and commercially available one. So first one is approved drug. Some of the drugs in phase 1 stage, some drugs in phase 2, then phase 3. So these are the some of the drugs from marine organisms. So natural product as a source for cancer treatment, because of natural product apparently evolved only for the purpose of alleviating the diseases. Plant form, so plant as well as from the beginning we started with the plant for the preparation of drugs, medicinal plant for preparation of drugs for the treatment of cancer, colon cancer, breast cancer, lung cancer, like that. So because of medicinal, ma'am already discussed with us. So we have a very n number of plants for the medicinal value. So that we concentrate the plant product for the first we initiated in our lab. Then we will move on to these are all the things, some of the statistics, how the marine organism evaluated or taken the drugs from the various purposes, anti-cancer and also antibacterial, anti-inflammatory purposes. So I don't want to go in detail about the natural products because of only the thing, what I wanted to emphasize these things. So most of the researcher, scientists and the other pharmaceutical industries also mainly concentrate the natural organisms for the preparation of drug because of the side effect and also they are tracing disease resistance also. So yes, so this is our what we are doing in our laboratory. So we are my specialization is biomolecules with biomedical applications. We isolate purify and characterize the compound bioactive molecules from medicinal plant as well as animal, especially for marine animals, because of marine sources are very high. So another important thing, they are not touched with the marine organism for the drug preparation because of very vast area. So we are going to touch with the things. So there are three ways. First, we will start with the plant product for the preparation of right. Then number two, we will because of we are belongs to zoology background, why we are not able to we are used for the marine organism for drug preparation. So number two, and also we checked with some of the commercial compound for already available compound for the checking of our drug as well as positive drug. So number two is the nanotherapy for cancer treatment because of targeted one. For example, if you take the 5 grams of a drug injected into the person, it will won't completely targeted the particular tumor region. So that purpose only scientists and researchers mainly consider the nanotherapy is a targeted therapy one. So we are doing all the things. Now we are mainly concentrate the drugs from the sea organisms. So these are all the various solvents, including aqueous, methanol, ethanol, chloroform, hexane, petrol, petroleum ether, ethyl acetate, acetone. So these are all the various compound which is used to extract the bioactive molecules from both plant as well as plant, especially for plant organisms, medicinal plants. So our main aim of our research is isolation, purification, and characterization of compound bioactive molecules, compound from the leaf, stem, root, extracts, flower also. So it depends upon the plant, we have to select the things. Then advanced techniques, synthesis and characterization of nanoparticle by purified compound. So after purification of compound, we will synthesize the nanoparticle, both gold as well as silver nanoparticle, because easily available one, non-toxic one. That's why we select the both nanoparticles, silver and gold nanoparticle, then determine the efficacy of both purified compound as well as synthesized nanoparticle. We have to compare both the synthesized compound, what is the efficacy of to killing the cancer cells in nanoparticle as well as compound. Either compound is good, we will go for the compound, otherwise we will go for the nanoparticles. So that we have framed the research work like this way. So, for example, first we will started with the Pitex legundo is in Tamil Nochi. Another one is Tatura inaxia, that is Moomathai. So we collect the leaves and also extracted, used various solvents for extraction. First, we will check the crude extract, different crude extract to the normal cell lines. So we will fix the dose. We will fix the dosage, concentration of the dosage. Then we will go for the breast cancer cell line or colon cancer cell line. So after that, first fix the dosage of the cells. Then we will go for the which one is best, which solvent is best active for the thing, at the same time side effects. So then we will go for the purification purpose. So we will isolate the bioactive compound from using different solvents. Which solvent extract is, food extract is most potential. That potential active extract go for the further purification. We will purify the compound, separate the compound, which compound is responsible for to kill the cancer cells. Then which that particular compound characterized by various methods, FESM, TLS, FTAR, like that we have the facilities, all the facilities for characterization of SEM and TEM like that. Then after characterization, we have to check the efficacy of killing the cancer, efficacy of both the compound as well as synthesized nanoparticle, both in vitro as well as in vivo. So first we will go for the in vitro studies. We will fix the standardization, all those things. In vitro and in vitro, in vivo is a different dose level, because of in vivo we have to use rat and rabbit as well as mice for the studies. In vivo, I said that in vivo. In vitro model, we have to use all the cancer cell line, including normal cells. So first we will check the normal cells. is there any side effect, or we will fix the concentration, then only we will move on to the studies, cancer studies. So here you can see some of the studies, in vitro studies. First, we will check the cell viability by trypan blue method. You know the thing, trypan blue, it will go and bind only the dead cells. So then cytotoxicity assay, MTT assay. So this is a specialized method which is used to MTT. It will go and bind with only live cells. Like that, we have to see the viability of the cells. Then cytomorphological study, nuclear morphological assay, apoptosis. Okay, the cell is a death. How it will death? We will confirm the PI stain and also Debye stain, and also further confirmation, we will go for the DNA fragmentation, apoptosis analysis, tunnel assay. So these are all the standard assays we have to use in our lab. So not only our lab, where actually they are using in the cancer biology, all the things they are using in the different assays. Then cell cycle analysis, especially used for apoptosis occur, but which stage it arrests the cell cycle. So we will go for the flow cytometry analysis. Mitochondrial membrane potential. So if we will analyze the potential of a membrane integrity of mitochondria because of powers of entire cells, how it will affect with help of our drug, it will go and penetrate the things. Then immunofluorescence analysis, protein profile and gene profile. So we have to use Western as well as PCR analysis. Is there any patterns, protein changes occur at gene level, any changes, both normal, that means controlled, as well as drug used one. Like that we are studying. Here you can see the biosynthesis, after synthesis of nanoparticle. That nanoparticle must be characterized with various standard methods. For example, FESM for morphological variations, energy dispersion X-ray spectroscopy, that's for presence of metal, X-ray diffraction with XRD, then FTIR. So these are all the various standard method we are using this for the purpose of characterization. So MTT assay, you can see the after crude preparation, we will check the different solvents for the standardize the which one is potential one. Then after selection of crude extracts, which potential active crude extract must be go for the purification. We have the well established column lab, and also after preparation, so we will go for the preliminary test for the separation of TLC. So basic one, thin layer chromatography method. Then we will go for the mass MS. We have touched with the biochemistry people, we characterize the thing, which compound is responsible for more active one. So we have the more than 50 elutions. All the 50 elutions were tested. The which one is any one of the elutions or fractions only active. So the active fractions must be clarify the things. So here you can see the synthesis of you can see the color changes synthesis. Then how to confirm the synthesis of silver nanoparticle, confirm UV is spectrophotometer. Then for morphological variations, analyze the SEM photograph for the in our laboratory. So this is a cytotoxicity assessment for the zero cell line. Same thing for cytotoxicity in cancer cell line, breast cancer, colon cancer, any cancer. So here you can see the comparison of control. Is there any morphological variations? That morphological variations must be there in the control and compared to the once you are increasing the drug level, so morphological changes must be there. That kind of things, instead of using inverted microscope, we can easily identify the morphological variations. Okay, our drug is work out for it will kill the breast cancer cells. How do you determine? You can go for the DNA fragmentation study. You can see the control. You can see is a control. You can see the intact DNA. Once increasing the hours as well as dose level, the DNA fragmentations will occur. So you can with this recording, you can confirm the DNA fragmentation. So nuclear changes, nuclear morphological changes also you can use the rubidium iodide stain. Is there a control versus treated one? You can easily separate the things. So these are all the thing confirmation. So cell cycle analysis using the flow cytometry, which stage the particular apoptotic cells will occur. Like that, this is for gene protein variations. Next one is Western blot and PCR analysis. Up to this level, we have applied for the patent. Is it in clinical stage? That is novel anti-tumor, anti-cancer property exhibiting compound. The given we will given the name. We have given the name Renaxi B. Applied for the patent 2014. Is in second phase. Almost in another 2 months it will clear the things. So sir already explained the best Indian science research nanotherapy for breast cancer. We have isolated the compound from breast cancer compound from Tatura and Axia. So apart from this, bivalves, we have zoology background. We isolate the protein molecules from marine bivalves, Donax variables. So we tested against the various cancer cell line, including breast cancer cell line. In breast cancer cell line work out very clearly. Sepia is the in Tamil kadama fish. They are edible one. So we isolate the protein molecules from different organs of Sepia propagaris, a new species identified in the Thoothukudi region. It's recently identified the Thoothukudi scientist people. We isolate the protein from different organs of Sepia to give the food. First, we give the food protein for kill the cancer cells, then purify the compound. Which compound is responsible for kill the things? We get separate one. Then we will go for the crude cone snail. You know the thing, cone snail. You can see the marina beach and the thing, seashore regions. So we isolate the venom. So toxic, highly toxic. We reduce the venom toxic. Give the treat as a drug for treatment of cancer. This is also one of the one student finished their PhD in functional sepia in separate rooms. Here you can see the jellyfish. So jellyfish, sepia, cone snail. So these are all the things that secrete the venom at the time of escaping. Two purposes: one is escaping from the predators. Another one is to take the feed from the. It will confuse the entire area, easily catch the feed. Two purposes. We isolate the nematocytes venom from the jellyfish. That venom treated as a drug molecule for various treatment of cancer. So these are all the various marine organism. We have to isolate the venom toxic protein as well as whole protein for the purpose of treatment of cancer. So first we started with the plant, a medicinal plant. Now slightly move on to the marine organisms. Two important things, because of we are from zoology background, and also other thing is many organisms not touched with the any other. We have a lot of properties in the especially for cancer properties in marine animal. So we have to analyze, identify, analyze the thing, characterize the compound used as a drug molecule for cancer. With this, I finished my research. I have shared my what are the things going on in our lab. Do you have any doubt? Most welcome. Thank you, ma'am. Thank you, sir. Thank you, ma'am.
Thank you, doctor. Thank you so much for your highly informative speech on the various bioactive molecules that we can use from the marine organisms. Like you rightly pointed out, it's a whole new domain other than just plants and animals that we could explore for cancer treatment, because it's the need of the hour currently. So thank you so much for your highly enlightening speech. Now, I would like to call upon, thank you, doctor. Now I would like to call upon Dr. Vaijayanti to introduce the last speaker for the day, Dr. Sameer Narayan Gore. Dr. Vaijayanti, over to you.
Thank you once again, Akshaya. Welcome once again, everyone. It's a pleasure to introduce Sameer Narayan Gore, consultant at Integrated.
Give me a spotlight, doctor, please. Before sharing the screen, spotlight the doctor if he's on video.
Yes, I'm doing that. Yeah.
Okay. You go ahead, Vaijayanti.
Sorry about the interruption. It's my pleasure and honor to introduce to you all Dr. Sameer Narayan Gore, Honorary Ayurveda Consultant at Integrated Cancer Treatment and Research Center, Wagholi, Pune. Dr. Gore has earned his MD in Kriyashari from Bharatiya Vidyapeeth University, Pune, and is currently pursuing his PhD in the same department. He has worked as Senior Research Fellow at Ayurveda Hospital and Cancer Research Hospital, Pune for more than 9 years and has rendered yeoman service as an honorary Ayurveda consultant at the Red Cross Society, Pune. Dr. Samir has presented numerous conference papers and has been invited to Israel and Japan for promoting Ayurveda. A hearty welcome to you, sir. The session is yours now.
Okay. Thank you, ma'am. Namaskar and good afternoon all. Am I audible?
Yes, sir.
Thank you. I would like to thank organizers for giving me an opportunity to talk on breast cancer management. I'm also thankful to my teacher, Dr. P.S. Suru and Dr. Sardeshmukh, who has given me an opportunity to work with the oncologist right from 22 years. With the blessings of our Guru, Gurutrayi Ratna Vaidyaraj Appa Shastri Datar, I will start my topic, that is an integrated approach to breast cancer management. In which conditions CA breast patients approaches to Ayurveda physicians? Almost 80% of the patients are undergoing chemotherapy or radiation therapy, that is conventional treatment, and or after completion of conventional treatment. Only 2% of patients, freshly diagnosed patients, who knowingly or willingly want to undergo only Ayurvedic treatment. 2%, not more than that. So we have to accept the integrative aspect. Now, this webinar is on Ayurvedic management of CA breast scope and limitations. So we have to understand the strength and as well as limitations of both, that is modern medicine and Ayurvedic medicine first. So strength of modern medicine, I think Dr. Ram Madhav has elaborated extremely well. So for the confirmation, I am telling again, confirmatory and near perfect. So modern strength of modern medicine is near confirmatory and perfect diagnosis. Breast tumor removal is possible by surgery. Regression of tumor or slow down the growth by radiation and chemo is possible, and periodic monitoring by imaging, lab test and tumor marker for prognosis of the disease. Now, what are the limitations of modern medicine? These are my aspects. Maybe some doctors are differ from with this my aspect, but what I observed is limitations of modern medicines are severe side effects of chemo and radiation. Quality of life can be hampered. Limitations in suggesting effective ways to prevent recurrence. That Dr. Ram Madhavan already mentioned that limited area for the breast cancer is not such thing. Systematic view is must, and so fails to understand the disease as a whole. Now, what are the strength of Ayurvedic medicine? Non-hazardous medicines, popularly known to layman as no side effects for Ayurvedic medicines. Panchakarma and Rasayan treatments are very effective for overall health maintenance, and Chitta or Manasa involvement, which is more important in these type of diseases nowadays. Now, what are the limitations of Ayurveda? It is difficult to diagnose it perfectly, and prognosis cannot be tell perfectly with the only Ayurveda Roga Pariksha or Rugna Pariksha. So we have to take help of the modern Roga Pariksha. Secondly, tumor regression might be difficult with only Ayurvedic medicines. And third one is it is difficult to handle emergencies related with breast cancers. This is applicable to other cancers also. So both these sciences have potentials as well as limitations. Effective fusion of both conventional and Ayurvedic treatment can offer good life to breast cancer patients. So integrative aspect for breast cancer treatment is extremely necessary. Now, already Dr. Bharati Madam has mentioned the causative factors. I have mentioned it as a non-modifiable and modifiable factors. Age, non-modifiable factor going from menarche to menopause, risk factor goes on higher level up to 8% every year. family history, 4 to 5 times higher risk patients having family history of breast cancer. Now genetical factor, BRCA1 and 2 mutations, more tendency to get breast cancer. Now radiation exposure to radiation is also one of the basic cause of breast cancer. Menstrual history, early menarche and late menopause may be the causative factor or risk factor. About obesity, after menopause, more in risk factor. Alcohol, Dr. Bharti madam has explained well, no need to go into details of it. Hormonal replacement therapy, estrogen levels go on, so increased risk is higher in hormone replacement therapy. So I would like to enhance on the BRCA1 and BRCA2 genetic mutations. So by the age of 70 years, BRCA1 mutation, patients having this mutation, chances of getting CA breast increases up to almost 70% and BRCA2 up to 60%. Now all these, you are must be aware all these symptoms and signs. I'm not going into details of it. Only thing we have to consider that upper lateral quadrant of breast is if there is lump, and possibilities of lump in this quadrant is more, that is 50%, and lower inner quadrant lump is, though it is in a less quantity, it has poor prognostic value because it can related with metastatic CA to sternal region. So diagnosis made by biopsy and other pathological investigations. Other pathological investigations to know about the type, grade and receptor status, etc. I'm not going into details of it, already you know it. Now it is important to look for the prognostic value. Depends upon prognosis, our Ayurvedic line of treatment also can be, we have to change according to it. So so first, all these are the prognostic values. So first is stage. It indicates the it is important to understand how tumor has spread or to know the tumor burden. I'm not getting into details of HSCC staging, but if tumor is less than 2 centimeter, can be called it as a stage 1 or stage 2 disease. Prognosis is better. Another staging system is lymph node involvement. If axillary lymph node is less than 4 are involved, good prognostic value, and of course metastatic disease has bad prognostic value. Now tumor morphology is, I am not going into details of it, but mucinous cancers are having good prognostic value. Now gradation is to know how tumor is aggressive. So 1 to 3 gradation is there. 1 indicates the good prognosis and 3 is bad prognosis. Lymphovascular invasion, it tells us that precursor to lymph node involvement. Now this Ki67 is not much of important, but Ki67 proliferation rate number goes to 1 to 100. If number is in between 1 to 15, prognosis is better. Now HER2 overexpression status and hormone receptor status, it is important to determine who will be benefited from endocrine therapy if hormone receptor status is positive, and who will be benefited from targeted therapy if HER2 overexpression status is positive. It is done by immunohistochemistry. So I have drawn this tabular form. Almost 50 to 60% of the patients are, we can find that estrogen receptor and progesterone receptor are positive, HER2 negative, which indicates good prognostic value. Now another 20% patients can be found as a ER/PR positive or either negative and HER2 positive. It indicates bad prognosis. ER/PR negative and Herceptin-2 protein negative can be found in 15% of the patients, and it indicates worse prognosis, called as a triple negative breast cancers. Now up to this modern, we have seen in a short how modern sees us as a CF breast. Now all these I'm not going into details of these types of CA breast. Infiltrating ductal carcinoma is more in number, that is 80%, which is having bad prognostic value. Already mentioned that triple negative breast cancers are worse prognosis. Paget's disease also bad prognosis, and inflammatory breast cancers worse prognosis. So I have not mentioned here stage 4 treatment protocol because it is a metastatic disease. No need to go into details of it. But for stage 1 and 2, 3 stages, local regional treatment, at least we have to know what is treatment is going on so that we can change our plan of treatment. So for the local regional, surgery and radiation is given. Systemic treatment, neoadjuvant mentioned by Dr. Ram Madhavan sir, to reduce the tumor burden. Neoadjuvant chemotherapy is given. They give along with adjuvant chemotherapy. Endocrine therapy, tamoxifen is a drug of choice, or aromatase inhibitor, that is anastrozole, can be used. And if protein HER2 targeted therapy is positive, trastuzumab, that is monoclonal antibody, they use it. Now up to this modern view CA breast we have seen in a short. Now all these useful information and knowledge we have to understand as per Ayurvedic point of view. As Sushrita says, pratyakshoto him yadrushtam shastradrushtam chaya bhavet samasatasto bhayo bhuyo jnana vivardhanam. So what we can experience in pratyaksha with the help of modern diagnostic tools or a roga pariksha, and what our shastra says, we have to correlate it and then use it in a clinical practice. So defining the exact role and goal of Ayurvedic treatment is extremely necessary before starting any treatment, not only for the CA breast but also for the any other cancers. So what are the aims of the Ayurvedic treatment? Prevent or minimize side effects. It may be immediate side effects like a stomatitis, or it may be longer side effects. Improve. Second target of the Ayurvedic treatment should be to improve quality of life. Third is prolong or prevent recurrence, and ultimate aim should be regression of tumor and or metastasis. Now before going into treatment part, what are the samanya samprapti and what are the constituents we can say include in cancer of breast? All the three doshas, dominantly kapha dosha. Rasa dhatu is vitiated in cancer breast because raja is a upadhatu and stanya and is a upadhatu of rasa. So we have to think rasa dhatu first. Then rakta dhatu also involved. As per Charaka, Shitoshna Snigdha Rukshadyahi Upakrantascha Gada, Samyak Sadhyana Siddhanti Raktajan Tan Bhavit. It means whenever the treatment is failure with the help of Snigdha or Ruksha Upchar, we have to think about Rakta Dhatu. Already mentioned by Madam, that is Arbuda, and for the Arbuda purpose, we have to consider Mausa as well as Meda Dhatu. And along with it, we have to consider of Shukra Dhatu also. Shukra Dhatu not only function is Apatya Prapti, but Navanirmiti, that Navanirmiti of regeneration of the cells is also hampered in these CA breast patients. Of course, another constituent we have to look for Oja. Oja Kshaya, Hetu and Lakshanas can be observed in CA breast patients. So all these consideration keeping in mind, we have to go ahead. Of course, Agni is vitiated and we have to see Rasava Srotas also along with Stanyava Srotas, and we have to consider in these days, especially in the breast cancer, Manovaha Srotas also. So what would be our plan or treatment principles for the Ayurvedic or Ayurvedic treatment in CA breast? Firstly, Madam also mentioned that Pachana should be there. Agni and Dhatwagni Vardhan should be our target. Rasana for to avoid Dhatugata Avastha or Dhatupaka Avastha and to improve the quality of Dhatu. Rasayana treatment should be there. Along with that, Balya medicines can be used. my experience is rather than giving any Karshana Janya medicines or Lekhana Dravyas, we have to think about Rasayana. It gives wonderful results. Sometimes we have to manage, or somehow we have to concentrate on Hetu Viparit Chikitsa. If nowadays we can easily observe that Manasa Hetus are more, we have to treat accordingly. Some Lakshana Viparit Chikitsa we have to manage because of the side effects of the conventional treatment, or some Vyadhi, another Vyadhi can be, we have to treat it in between our main course of the treatment. Now, prevention of the metastasis. We know that cancer, CA breast, can spread to lung easily. So we have to think to prevention of that metastasis in the lung. So we have to give medicines which will act on pranava srotas along with fufusa. I personally use some Agasti Rasayan or Abrak Basma or any other Chavanprash or something. We have to take consideration all the Rugna Pariksha and disease condition. Now Shodhana is extremely helpful, but we have to take care Bala Rakshan of the patient. Otherwise, Panchakarma won't be helpful that much. Along with Panchakarma, some allied procedures all are also useful for the pain management. For example, if in CA breast metastasis is gone on bones, so we can perform Pindasved to reduce pain. So otherwise, Shirodhara also can be useful for the pain management and relaxation. Now, another important aspect is Ashwasana Chikitsa. That is counseling, not only for the patient, but along with it, family members of, it is required to family members also. Now, next point is, we have to take consideration of diet, already mentioned by the madam, so no need to go into details of it. And lifestyle modification, already mentioned, the yoga and pranayam, all these things, we can take care of CA breast patients. Now, what chikitsa dravyas or medicines can be useful in CA breast patients? These dravyas routinely used in my clinical practice or in our hospitals, but according to your convenience or your style of practice or availability of drugs, taking consideration in desha, kala, rutu, and examination of patient, you can change as per your convenience these medicines. These are the guidelines you have to consider for yourself. I routinely use kalpas of Ananta and Shatavari for the Shita and Rakta Prasadak. Patients who are undergoing radiation, we routinely use this Ananta and Shatavari kalpas. Gudichi is Rasayana. Another drug is Vruddha Daru, which will act on Shukra Dhatu, Bala and Oja Vardhana. So I routinely use this Vruddha Dharuk. Along with it, Purnaviti Punarnava, to correct the rejuvenation of cells, I use Punarnava. Along with it, various kalpas can be useful. If Mukti Kamduda, I use routinely to reduce side effects of chemotherapy and radiation, considering the Tikshna and Ushna property related with or toxic drugs. Mukti Kamduda along with Pravala Basma is useful. In taking consideration involved metastasis, if suppose metastasis is in liver, you can use Arogyavardhini. Now Trailak Chintamani contains Hirak Basma, can be useful. Suvarna Malini Vasanta is drug of choice for me because it is Rasayana. Navneet is excellent on Shukra. It will take care. Maricha will increase Pachana. So Suvarna Malini Vasanta I use routinely. Now Yashti Gruta or Padmakadi Gruta is also useful to treat side effects of radiation. So I routinely use this Yashti Gruta and Padmakadi Gruta. Gruta Kalpana is extremely useful in radiation of any other cancer patients. Now, it is important to use all these theoretical knowledge into clinical practice. So I have incorporated and selected few cases. So we will go through it. Case 1, I have included it because it is extremely rare case, that is male patient having CA breast. It is not more than 1% patient having male patient having CA breast. So case of infiltrating ductal carcinoma of left breast in male. Age at diagnosis was 56 years. Present age 67 years. Diagnosed in 2010. Grade 3 stage 2 ER positive, that is estrogen receptor positive. Left MRM done in July 2010. 6 cycles of chemo completed in January 2011. Hormonal treatment, he was on tamoxifen because of estrogen receptor was positive. Started Ayurvedic treatment before chemo. So considering the rationale behind it, so Shaman Chikitsa was given to reduce the side effects of the chemo. That is, we used it, as I had said earlier, that Muktikyukta Kamduda, Pravalabhasma, Anantakalpa were used to reduce the side effects of the chemo. And Rasayan Chikitsa was given later, used Suvarnamalini Vasanta. Then periodical Basti treatment was administered. Patient was complaining of krumi. So taking consideration krumi as a hetu, we used krumigna basti with the karanza tail for matra basti, and then shodhana basti, and then yapana basti. Almost once a year, 8 times we done panchakarma with the basti. Then Vamana was done, taking consideration that kapha dominance in this disease in 2013. Now, what is the outcome of this all treatment? Symptoms such as dragging pain from operator site, weakness and weight loss were reduced significantly. Tolerated chemotherapy well. Remission period more than 11 years, which is very much significant, and no recurrence yet, and metastasis observed. So next case, this is the histopathological report of this patient, diagnosed in July 2010, and now latest reports of PET CT showing no loco-regional recurrence and distant organ involvement yet. Next case is of sternal metastasis, 64. I have mentioned here all these cases in very short manner. Next case is of sternal mets, 64 years of female, diagnosed in March 2012. Sternal metastasis developed in 2015. Ayurvedic treatment started from March 2016 after chemo and surgery. Mainly, as I said earlier, target was to restrict the disease to spread. So Rasayana treatment was introduced. Suvarna Bhasma Adi Yoga, that is Suvarna Bhasma and Amruta Sattva, etc. was used. What is the outcome of this treatment in this patient? Remarkable improvement in quality of life. In spite of aggressive nature of disease, patient survived for 10 years or more than that. 10 years survival rate in these type of patients, relative survival rate is only 10%. So this patient also got excellent result with the help of Ayurvedic treatment. Now third case is of triple negative blood cancer, 42 years of, this is all these 42 years of female, diagnosed in June 2013. Neoadjuvant chemotherapy to reduce tumor burden, 2 cycles were given. After that, I started Ayurvedic treatment. Then chemotherapy and surgery was done. As per Hetus, Manas Hetu was there, related with some family issues, and Katurasa Sevan Hetu was there. So taking consideration, rationale was Jatamausi used for the Manasa Hetu along with Saraswatarishta, Pittalamak and Rakta Prasadak, Praval and Muktik to reduce side effects, and Rasayana, again Suvarna Malini Vasant was drug of choice, and it gave wonderful result. Tolerated chemo well, gave follow-up almost for 7 years and no recurrence up to that. Quality of life was in between the treatment was excellent. Now last case is of HER2 positive and triple positive. Age at diagnosis, I have taken this case to elaborate the later side effect of chemo drug, that is adriamycin was used for, it has a severe cardiotoxic effect. So I have taken this case for the mentioning, and this case taught me a lot. Age at diagnosis was 31 years. Felt lump in left upper lateral quadrant in December 14, diagnosed as a diagnosis in March 2015, received 4 cycles of neoadjuvant chemotherapy considering to reduce burden of tumor. Adriamycin and cyclophosphamide along with 5-fluorouracil was used. Surgery done in July 15, then 4 chemo cycles given in October 15. Local RT was given in December 15. She was on tamoxifen and tablet Zoladex post RT to take care of bone structure. Then in 2016, CT abdomen was done and found hemangioma. Then she started Ayurvedic treatment in September 16. But because of imbalance of hormone, salpingo-menorrhagia was started. So salpingo-oophorectomy done in March 17. Then after that, anastrozole was started in June 17. Up to this, PET-CT was normal in December 17. But in June 19, exertional dyspnea was started. I missed that, the severity of the drug of adriamycin, where she admitted to the hospital and diagnosed as in 2D echo as left wall hypokinesia, dilated cardiomyopathy, ejection fraction was 25%, and pulmonary hypertension was developed. Then we started along with allopathy. Our target of treatment was changed to take care of cardiac related activities. So after that, PET-CT was normal in January 2020. Last follow-up she gave in January 21. Now, rationale behind the Ayurvedic treatment, considering the Manas Hetu, as given all the Saraswata and all these things, but this was a more complex disease to treat. The Rasadushti was there, Yakruta Dishtu, that hemangioma was there. She started Kashtartava, side effects like a Sandishul and Udavarta or Rutshul was started in a severe manner. So considering all these things, I have to change medicine according to it. So medicines were used, Falatrikadi Gugul, which acts on liver, Astiposhakvati to take care of Astidhatu, Prabhakarvati for cardiac activity, Suvarna Malini Vasant as a Rasayan, and Saraswatarishta for Manasa Hetus. Outcome is not so important, but this case I learned very much from this case. Outcome was symptomatic relief for the patient and quality of life was increased. Recurrence avoided for almost more than 7 years. So up to this we can achieve. Of course, this is my opinion and my thinking process. You can change according to your experience and your clinical practice. So thank you so much. I think I have finished within time. Thank you so much for giving me an opportunity. Dhanyavad.
Thank you, Doctor. Yes, you have done a great job of concising it, presenting it to the point. So thank you so much for the highly informative speech, elaborating the scope and limitations of both general medicine as well as Ayurveda, and the case studies that you have just showed us. Sorry. The case studies have helped us in understanding the benefits and the potential of integrated treatment approach towards improving the prognosis. Like you have rightly mentioned that early detection saves lives. Unfortunately, due to time constraints, we'll be skipping the question and answer session. As I mentioned in the chat below, kindly key in your questions. We'll definitely reach out to the speakers and get back to you with their answers. So I would now like to call upon Mr. S.N. Balasubramanian, trustee of Giridhar Rehabilitation and Care Endowment, who who is also associated as a strategist and mentor with Heavenly Fuel Private Limited, to put forward his closing remarks for the event.
Good afternoon.
Dr. Gore, can you please stop your screen sharing?
Yeah.
Unable to spotlight Mr. S. and Balasubramanian.
I'll try. I'll stop Courage's screen sharing.
Yeah, thank you so much.
Good afternoon. Warm greetings to one and all. It is often said that dreams are to be chased, maybe true of mundane and materialistic dreams, but noble dreams are to be cherished and nourished. This webinar is the outcome of such a noble dream of a youngster who envisioned disease-free world. Giridhar's dream of disease-free world may appear utopian, may be impracticable too, but we at Giridhar Rehabilitation and Care Endowment firmly believe that with the totally committed team and the unstinted support from well-wishers like you, the difficult tasks we do immediately and the impossible takes just a little longer. And this webinar is again such an initiative. Today, this morning, we had a brilliant knowledge session. I'd like to appreciate the doctors for sparing their valuable time to be with us this morning. We are thankful to the domain experts. I would like to call them the awesome foursome: Dr. Ram Madhavan, Dr. Bharati Kumaramangalam, Dr. Arul Vasu, and Dr. Samin Narayan Gore, who concise their abundant knowledge in a capsule form for the easy digestion and absorption by both medicos and non-medico participants at this webinar. Let noble thoughts come to us from all directions, says Rigveda. We endorse this and aim to alleviate the pains of the patients through a balanced, integrated system of medicine to realize the state of well-being and the disease-free world desired by Giri. Let me congratulate, appreciate, and thank Dr. Harikrishna, Dr. Vaijayanti, Akshaya Ramakrishnan, Banu Deepti, Dr. Kamaraj, and Priyadarshi of the core team, and Priya, Kavita, Aravindan, and Narayanaswamy of the support team, and all other team members for curating this webinar in absolute style. Hats off to you, team members. I am proud of you. Of course, the participants in large number made a lot of difference, and they made this webinar meaningful. We also owe our gratitude to Mrs. Lata Venkatakrishnan, our managing trustee, who has put behind her personal tragedies and stoically and is striving with utmost focus to achieve the dream of her son Giridhar. Hats off to you, madam, for your dedication and determination. I once again thank the doctors for sharing their knowledge in abundance without holding back, and we are really thrilled to see such a epoch-making progress is made in the alternate medicine. I rather normally say, which is the alternate medicine, whether the time-tested Ayurveda or the modern medicine, which is the alternate medicine. But you all proved today the Ayurvedic, with the limitations, which is also there in the modern medicine. We can do wonders with alternate medicine. Thanks a lot. So long, friends, till we meet and greet again at the next webinar or maybe seminar as the COVID pandemic is coming down. So long. Thank you so much. We enjoyed this webinar thoroughly. Thanks a lot.
Thank you, sir. As you all know, all good things come to an end. I now request upon Dr. M. Hari Krishnan to deliver his vote of thanks. Dr. Hari.
Out of ecstasy, we at Pragnya 2022 first thank the Almighty for making this happen, because it was a wonderful day containing inputs from domain experts from medicine, from Ayurvedic medicine and the biosciences field. It all started with a wonderful prayer rendition by Ms. Banu Deepthi. The rendition was wonderful, and we had the opening remarks by our MD, Mrs. Lata Venkatakrishnan, who has been the torchbearer of all our efforts, who has been the backbone, inspiring us and also giving us all the support and encouragement to carry out our research activities. We thank Dr. Ram Madhavan, who has given us the glimpses of history and the evolution of various treatment modalities for breast cancer. Without knowing history, it is not possible to understand science, and this we have realized today yet again. Next came Dr. Bharati Kumar Mangalam, who had emphasized the importance of following what has been told in the Ayurvedic texts regarding Rajaswala Paricharya, Ritumati Paricharya, etc., as well as throwing light on the current research activities which are happening regarding the use of herbs in the management of breast cancer across premier Ayurvedic institutes in the country. We thank Dr. C. Arul Vasu, who has taken us on a pleasant voyage through the ocean of aquatic biomolecule sources, which was something new for all of us, most of us, I would say. Thank you so much, sir. And last but not the least, Dr. Samir Ghore has given us the real picture by integrating modern and Ayurveda, not only in his presentation, but also in the real situation by absorbing the goodness of both the systems and implementing it and contributing to breast cancer care in the fullest extent possible. We thank our mentor, Mr. S. N. Balasubramaniam, who has been strategizing all our efforts, who has given valuable inputs, made us correct our wrongdoings at the right time, and always patted whenever we did something great, and we always owe our achievements to him. We thank the MC of this meeting, Ms. Akshaya Ramakrishnan, for it all together. We thank our entire research team, Dr. Kamaraj, Ms. Priyadashini, all our support staff, Mr. Aravindan, Mr. Narayan Swami, Mr. Srinivasan, Mr. Mahesh, Ms. Kavita, and whomsoever, whatever name which we have forgotten to mention, kindly bear with us. But the entire program was a grand success. We will be organizing many such programs in the days to come. Pragnya 2023 will be a different topic, but there will be many more online sessions and offline sessions through social media like Facebook or YouTube. Please stay tuned for on our Heavenly Fuel Facebook page for more updates. Thank you one and all. Jai Hind.
Thank you so much. So we are ending the meeting now, and all the questions and answers will be answered through email as told by the MC. Thank you. And you can follow us on Instagram Heavenly Fuel and Facebook Heavenly Fuel page for more updates. And you can also visit our Heavenly Fuel page on YouTube and on LinkedIn too. Thank you once again. See you at Pragnya 2023.